tip on 3 steps to great exam greetings. This is Wendy Myers with Communication Solutions for Veterinarians in Denver, Colorado, and we help practice teams improve communication skills, compliance, and client service. You can get information on our webinars and training programs at csvets.com. So, step one is to introduce yourself before you walk into the exam room. Now, before you turn the handle on that door, please do check either the electronic medical record or the paper chart to identify whether you've previously met this client, because you don't want to go in and introduce yourself and the client's known you for 5 years. That's going to look like you're not paying attention to details. So you've taken a peek at the record and you see that you've met me before and my kitten Alex. So when you walk into the room, you're going to have that very friendly returning greeting of, well, hello, Mrs. Myers. It's great to see you and Alex again. And the word again communicates a returning relationship, and you're showing appreciation for my business. Now, if you're meeting that client for the very first time, I'd like you to tell them welcome to your hospital and then explain your role. So you're going to introduce yourself and say, I'm Sandy, the technician who will be assisting Dr. Jones today. Step two is to shake that client's hand. And this is true whether it's a returning client or a new client who you're meeting for the very first time. This is a great way to immediately establish rapport. You want to give about a 3 to 5 pump handshake and stand about 16 inches from the client. This is enough personal space to give people. Now, psychologists have actually shown that that simple gesture of a handshake is actually equal to about 3 hours of interaction. And this will just in a matter of seconds help you establish that initial trust and rapport. Now, please shake with confidence. Give a very firm, confident handshake. Don't give me a clammy, limpy, dying fish. That is actually going to communicate a weakness that you're maybe unsure. So make sure you show your professionalism. There's a lot of power in the touch of a handshake. Now, step three is to set expectations. So when you go into the exam room as the technician, I like you to introduce yourself and then give them a preview of what is on today's list for medical services. So in this example, the technician would explain that for your preventive care visit today, we're going to do a nose to tail exam. I always lead with the exam because that's the very first thing the doctor does, and I honestly feel it's the most important. We also will do vaccines. I usually don't have the technician detail which ones, because after the doctor takes a very thorough and complete medical history, he may decide to add or subtract certain vaccines. We also are going to do a heartworm tick test and an intestinal parasite screen. And you'll notice here that I've used very client-friendly, easy to understand language, avoiding any medical jargon. And then we will refill 12 months of your flea tick and heartworm prevention. Saying we will refill is a compliance technique that encourages year-round protection for that pet. And if the client's here for an annual or semi-annual checkup, chances are very high that she's almost out or completely out of preventatives. Then you're going to explain your role in the first step. So I'm going to take a brief history, collect samples for testing, and then get your pet's temperature, pulse, and respiration. Then the doctor will join us to begin that exam. Is there anything else that you want to be sure and discuss with the doctor today? Now, this question is very important to ask, and I actually front load it at the beginning of the visit. Because let's say that I'm at your practice with my 5-year-old cat, Camus, and I share with the technician that Camus has been going potty outside of the litter box for about 2 to 3 weeks now. She would immediately respond to that because that now becomes the number one chief complaint for today's visit that we need to address. And she might say to me, Wendy, anytime that we have an adult cat that's going potty outside the litter box, the doctor always starts with the urinalysis because we need to determine, is this a medical problem or a behavior problem? I'm going to go ahead and take Camus to the treatment area now. We'll collect that urine sample, get the test started, and we will have an answer for you in today's visit. And this really communicates confidence in me. It also helps you prioritize the visit because the worst case scenario might be is that we go through the whole checkup with the doctor and technician, and then the doctor might close with, Wendy, did you have any other questions? And I say, oh yeah, Camus has been going potty outside the litter box. Whoops, I've just added another 20 to 30 minutes to the appointment time. So when you front load this question and ask, is there anything else you want to be sure and cover with the doctor today? It helps you efficiently manage your exam time. And I find that a lot of clients who are bringing their pets in for checkups may have other health concerns that they want you to address. It might be signs of arthritis or they're just ain't doing right. You want to identify that so that we can truly solve those problems. I hope you've enjoyed our video tip on 3 steps to great exam greetings. You can get additional information on our training programs and services at csvets.com. See you again next month for another tip.